Hello everyone and welcome to MedVize TV, a show where pharmacists like myself give you the information you need to better manage your health and medications. Today's topic, we're going to talk about dry eyes. Millions of Americans suffer from dry eyes, and although it can be, a burden on your quality of life, it's also pretty important to treat it because having your eyes well hydrated can actually prevent infections of the eye and also prevent injury from the surface of your eye. So I'm here to help you be well equipped to choose an over-the-counter product to treat dry eyes and also understand some of the prescription options that are available. But first, let's talk about what causes it. It's important to understand what causes dry eyes, as if we can figure out what is causing your eyes to feel dry and we can pinpoint that and address that, that's going to be a great way to treat it, because as we all know, prevention is the best form of treatment. So here are the most common causes for dry eyes. Dry environments, high altitude, wearing contact lenses, prolonged computer use, hormonal diseases and postmenopausal estrogen, smoking, eye surgeries like LASIK, prolonged use of artificial tears that contain preservatives, vitamin A deficiency, and also a full list of medications. Now that we've talked about some of the causes, hopefully it's something that you can address. Hopefully it's something that you can try to prevent having dry eyes in the first place. But if not, now we're going to go over some over-the-counter options to best treat it. So the main over-the-counter option that's going to be available to you to treat your dry eyes is going to be artificial tears. Now there's a bunch of these available, so it can get confusing. And there's actually no evidence that shows that one is going to work better than the other, but there's some important things to know before picking the right one for you. Make sure that it doesn't say redness reliever on the box. If it says redness reliever on the box, that could contain a medication that could also be causing dry eyes. And because there's so many options available, some of them do have different lubricants inside, and one might work for you and one might not. It's going to be a trial and error to see what is going to be the best artificial tears for you. Another thing to keep in mind is that the artificial tears that you decide to choose, make sure it is preservative free. If it has preservatives in them, it's not good to be used for long term. If this is something that you're going to be using often to treat your dry eyes, it should say preservative free, and those usually come in individual use vials. If your artificial tears contains preservatives, if you use that for long periods of time, it could actually damage your eye and also cause dry eyes. If you are a contact lens wearer, not like myself, but if you wear contacts, make sure to get yourself a re-wetting drop, like this one. Another important thing to know when you're choosing the right artificial tears is that they come in drops, which are like a suspension, but they also come in gels and ointments. So the gels and the ointments generally work better, but they can cause blurry vision. So these are usually only good to use at nighttime, or if you have really dry eyes right when you wake up in the morning, you could use a gel and ointment right before you go to bed. So when using artificial tears, it's important to know that the ideal probably max that you want to stay at in terms of how many times a day to use it is going to be 4 times a day. When you start using it more than 4 times a day, there are some studies that show that this could actually cause your eyes to actually become more dry and cause further damage to your eyes. So if you've been using the over-the-counter artificial tears available and you're just not getting the relief that you wanted to, it might be time to make an appointment with your primary care provider or an eye specialist. Upon further evaluation, they're going to be able to tell you if you're going to be a good candidate for a prescription medication, or they might determine that you're going to need a form of surgery or procedure be done to help treat your dry eyes. However, these are usually used for more severe cases. So now let's talk about the prescription options. There's 2 really common prescription options available to treat dry eyes, and that's Restasis and Xiidra. Restasis is pretty expensive and it doesn't work for everyone, but there are some people that get really good results. But it's important to know that Restasis shouldn't be used if your dry eyes are caused by contact use, or if your dry eyes is a result from a eye procedure such as LASIK. The most common side effect of Restasis is burning of the eyes, and if you do plan to use it with other eye drops, make sure to separate the administration of the Restasis with about 15 minutes in between. Another thing to note about Restasis is that Restasis can take about 3 months to work. So it's not like the artificial tears where usually you'd get immediate relief, but it does take almost about 3 months to really start feeling the full effects of that medication. Now, Xiidra is another type of prescription medication that's available. Xiidra does seem to work a little bit faster. A lot of people see better results within 6 to 12 weeks. But the most common side effect associated with Xiidra is a bad taste in the mouth. And the reason that happens is because when you put an eye drop into your eye, you have these ducts that leak into your nasal passage that in turn can leak into your throat. So because of that, when it does get to your throat, it really can give this feeling of a bad taste sensation. To prevent that bad taste from happening, or to try to minimize it, after you put the eye drops in your eye, if you squeeze the bridge of your nose here with your hands, right around there, after you administer that medication for a few seconds, it's probably going to prevent that eye drop from going into your nasal passages down into your throat to cause that side effect. Your fingers should be as far back as possible, almost touching your eyes there. It's going to feel a little weird, and hopefully you won't have glasses on while you're doing it. Some other prescription options available to treat your dry eyes is corticosteroids and antibiotics. Some dry eye disease states is thought to occur because of inflammation in the eyes. So using corticosteroid drops or antibiotics is supposed to help decrease that inflammation and help with the dry eyes, but these are usually not the preferred treatments. There's also something called Lacrocert that can be used to treat your dry eyes, but again, that's also not preferred. It's actually a lubricant-based type of medication that you insert into your eye. It's actually like a little grain of rice that you insert into your eye that's supposed to help with treating dry eyes. I'll include a video in the link below to show you exactly how Lacrocert works. And lastly, there's prescription medications that are tear stimulating, but again, these are also not preferred because they do come with some bad side effects. So that's all I got today. I really hope this was helpful. If you have any other questions about how to treat your dry eyes, please feel free to reach out to me. You can send me an email at richard@medvize.com. Thanks for watching. Take care.